So this evening we're very happy to welcome two people from dentistry. So one is a final year dental student, Ying Yun Chan, and we also have Dipani Vimalraj. Dipani is now a qualified dentist. Both Ying and Dipani are from King's College London and were involved in doing the Planetary Health Report Card at King's College London. We also have Ellie Pilkington, who graduated this year from Keele University and is currently working as a foundation year pharmacist. And we also have Ramisa Ahmed, who is also working as a foundation year pharmacist and has graduated from the University of Portsmouth. So this evening we're going to hear the experience of the students who've been involved in the Planetary Health Report Card. If you're not familiar with the Planetary Health Report Card, the QR code here on the screen will take you directly to the website, and you can read the report cards from 2025, which were published in April. But I am going to hand over now to our students for them to tell you about their experience of working in the Planetary Health Report Card. So let me just stop sharing my slides. And I think Jing hasn't joined us yet. So Dipani, if you would like to kick off, you can share your screen whenever you're ready.
Am I sharing at the moment?
Yes, just waiting for the presenter view to come up.
And can you
Perfect.
see that?
Yes,
Perfect.
lovely.
Okay, so my name is Dipani and I'll be discussing my experience of completing the Planetary Health Report Card for its pilot edition in dentistry. So I graduated as a dentist from King's College London and I'm currently taking my foundation training in the West Midlands. As I mentioned earlier, we had completed the pilot edition of the report card for dentistry representing FODOCs at King's. My motivation to participate was driven by seminars held during the clinical humanities module that was as part of our undergraduate training. We had quite a few speakers, both national and international, who discussed the environmental and climate change impact on oral health and disease. And whilst I'd always been sort of aware of the health impacts of climate change, so asthma and things like that, I hadn't really put dentistry and dental disease sort of in that category, and thus didn't recognize very clearly the impact of dentistry on climate change and vice versa. So the report card served as an opportunity to educate myself on those crucial principles, but also reflect on my own daily activities related to dentistry, and to see the impact that I was having on climate and environment in my profession. Needless to say, it was an eye-opener and has changed the way that I practice dentistry now. So I collaborated with a colleague in my course and clinical humanities module lead and mentor, Dr. Zara, to complete the report. My colleague and I allocated sections of the report card we were each responsible for. So in its pilot edition, it had 5 main sections. We split the first section between the 2 of us and then took 2 each. We also made sure that we were responsible to find resources pertaining to our section of the report. However, we made sure to sort of share resources between us and keep them in a shared folder, just so that we can peer review any sort of research found, and use any sort of elements that would be relevant in different sections. I would highly recommend when doing the report card to split the load that way, just because there is a lot of detail that is needed to address the domains, and there are quite a few questions within each domain. So it would be really beneficial to sort of split the task and peer review as needed. We also made sure to consult Dr. Zara on any gaps that we had noticed to make sure that we hadn't missed any data. And we found that Dr. Zara had quite a few insights that we hadn't picked up first time round. We had completed the evaluation in such a way that the findings were presented, the benefits of the findings were analysed, and any gaps present were identified and then a solution provided. So that's how we sort of structured our reflection. So where did we find the information? What did the information show us that we were doing well? What were the gaps that we noticed? And how can we sort of rectify this and reflect on this in future editions? Essentially, we use the report card as an audit process, essentially. So just reflecting on the actual experience itself, it provided me with a great opportunity to reflect on my own current practices and helped me identify how my clinical work can contribute to the wider prevalent concerns regarding climate change and planetary health. From this experience, I have noticed the great importance of preventative dentistry in reducing material consumption for restorative work, and frequent travel for patients who have to attend multiple appointments to have treatment that could have been avoided if, preventative dentistry was done, or patients were more on board with oral hygiene advice and diet advice. I've also become more conscious of the materials and the products I use, opting to use reusable instruments as much as I can. And in the case that disposable instruments are used, I will only take what is required and try not to sort of take more, in the worry that I'd have to waste time trying to find that instrument. I'd rather just take what I need and then take more if necessary. I'd also make sure to sort of not contaminate any other instruments that are sort of in a tray or in a drawer, so using forceps or something to withdraw instruments so that we don't waste instruments in that way as well. I've also become more vigilant of the environmental consequences on a person's general health and well-being, and then how that general well-being can then impact their dental health. So an example I always use is the impact of pollution on asthma and the rates of asthma, and then how that directly affects dental disease, with a lot of patients presenting with things like candidiasis in the mouth following use of inhalers. The project also provided me with transferable skills, developing my reflective thinking skills. I found that the experience helped me improve my process of troubleshooting, helping identify more practical and efficient solutions to clinical resource allocation and sustainable patient management. I did encounter many challenges completing the report card, one of which was trying to find all the relevant data and taking the time to analyze information carefully and selecting what was necessary to fulfill the scope of the question in the report. In these instances, I found it greatly beneficial to consult with my collaborators to obtain a second opinion on the relevance of the data found. Another thing we struggled with was trying to find solutions to the gaps identified. Whilst it might be easy to propose improvements, we also had to consider the practicality and the stakeholders involved in making it work. Dr. Zara was greatly insightful in this as well and guided us in making these suggestions. I would highly recommend consulting with a senior lead when completing the report card, to address these concerns and to assess if any plans are already being made to action, or are already being raised in similar to your suggestions. So based on my experience, I would advise the following as my top tips. I'd highly recommend for a shared folder and a group chat to be created to discuss the report and compile all the evidence in one space. Make sure to keep a note of any hyperlinks, as these can be directly embedded in the report. We found that when we complete our report, we were able to sort of directly direct our audience to the relevant article or PDF. And so keeping hyperlinks is really important. I also think it's really imperative that you understand what the domain or the question is asking for in particular. When we completed the pilot edition, we were often unsure of what each question required and didn't have previous examples to consult. So if you do have previous examples of report cards that you can look for, look and see, make sure you sort of read them to get a flavour of what criteria or examples you should be considering and citing per domain. This also means that you might need to be creative and sort of broaden your thought process. So think beyond the obvious and examine the curriculum for any lectures or seminars that consider planetary health. On completing our report, I often found that a lot of valuable insights and modules that you wouldn't think would cover planetary health actually covered it to a good extent. I would also consider the time commitment involved. My colleague and I worked on this together, and it was just the two of us and a senior lead. And we did find that we managed our time well. However, we did appreciate that it was quite time consuming to compile the evidence and then answer the report card questions to a very high standard. And we wanted a really good sort of reflection. And so we did find that we were spending more time on the reflection portion of it. So it's just something to bear in mind, that you need to sort of be efficient in allocating tasks between team members, and being aware of a standard of sort of reflection that you'd want to share amongst everyone. I'd say that the majority of the time, again, was spent compiling the evidence, and then once this was done, the report was completed fairly quickly and efficiently. I would also recommend participating in other opportunities following completion of this report. So my colleague and I submitted our poster to the SHARE conference in 2024, which is just shown there. We also presented at 2 other conferences our findings and our findings essentially. But thank you so much for your time, and I'm happy to answer any questions at the end. Thank you.
Great. Thank you so much, Dipani. That's really helpful and really insightful. So we're going to do questions at the end. If people have questions, please do put them in the chat box as we go along, and then we'll put them to all our speakers at the end of the session. So Jing, I think you've joined us. Are you able to share your slides if you want to go up next?
Yeah, I'll share my slides.
Hi. Great. Okay, great. Off you go. Thank you.
Okay, so my name's Jane. I'm a final year dental student at King's College London, and this is what sort of I went through and what I learned when I was doing the PHRC. So the PHRC stands for the Planetary Health Report Card. It's basically a student-driven metric-based tool, and it evaluates health professional schools across 5 key domains. So the first one's curriculum, which is what you learn on your course. Second one is interdisciplinary research, which is how much your school contributes to research in that field. The third is support for student initiatives. So it's sort of how many grants or funds or just the different ways in which the school or faculty can support students wanting to do extra research. Fourth is community outreach. And fifth is how sustainable the actual campus is. So this is quite a big initiative with more than 100 health professional schools across more than 15 countries participating. So on the right side of the screen, I put a screenshot of a part of the PHRC that our group did for 2024 to 25. And then at the bottom, you can see sort of like a summary chart. So the chart on the left shows how well our school did in each of the 5 domains. So we can see the percentage that we got for each of the rubrics, and we've assigned a grade, so A, B, C, D for each of those. And then on the right, we compared how we did in 2025 to sort of we could see the improvements or anything that had deproved from the previous year, which was 2024. Okay, so why oh, sorry, can you see my screen?
Oh, no, your screen just disappeared, Jing.
Okay, that's fine. Let me try again.
Don't worry.
Okay, is it back on?
Yeah, it's back.
Okay,
yeah,
sorry
good.
about that. So
No
why did I
worries.
join the PHRC? So first of all, this was quite new to me. I've never done anything like this before. So I wanted to get involved in evidence-based practice for net zero health systems. My colleagues and I just thought, it's something new. We've never tried it before. Why not give it a try? It's our second last year in dental school. Let's just go for it. The second reason why I joined is because I would like to improve my critical analysis skills. So like my colleague Dipani said, this exercise really required us to analyze everything in our curriculum, and we had to dig up information. And lastly, we also got to work with Dr. Flora, who's the staff lead, to advocate for sustainability within the curriculum, because obviously we could identify areas in which we were lacking in and feed that back to her. So in terms of the process, we were recruited in November 2024, and then we were required to submit a draft of the report in February the next year. Our final report was due in March, which I thought was a good time because our final exams were in May. And then we got to present our poster at the SHARE conference in April that year. So what did we learn? We learned time management. We spent 5 to 6 hours on the report. I think we would have spent longer, but Dipani and Josh, who led the report last year, they did most of the work. So all we had to do was identify anything that had changed in the grading system and just update it. We also learned teamwork because it was me and 2 other colleagues that worked together. We learned how to do research and how to present our findings in an accessible way. we learned to extract and interpret large data sets because, as you can imagine, we were digging through the curriculum over 5 years. So that was quite challenging, but we did learn quite a lot from that. Another thing we learned was critical analysis of institutional activities. So we felt like we knew more about what our university was doing after having completed this exercise. And we also found the value of being transparent when publishing your findings because, some people were less transparent when they were talking about fossil fuels, for example. So in those cases, we had to follow up a lot, and it was extra work for us, but we saw the value of being transparent through that. So of course we faced some challenges. Some data sets were incomplete and we needed to follow up for clarification. That took quite a while. We had to accommodate to everyone's schedules, but I wouldn't say this is the biggest challenge because the three of us were in the same sort of tutor group, so we had a really similar timetable. It was also difficult for us to interpret large sections of information and translate this into information that people could understand. So my tips for if you were to do the PHRC would be to start early and have clearly defined roles and timelines. You should also delegate tasks effectively and make sure to check in regularly before deadlines because things do come up. And don't be scared to ask for feedback and help when you need, because we did that and we found it really, really helpful, the feedback that we were given. So thank you for listening, and I'm happy to answer any questions that you might have.
Great, thank you so much, Jing. And I know you need to rush off, don't you? So if anybody has any questions for Jing, if you want to just raise your hand now or pop them into the chat. I have a quick question whilst we're waiting, if that's all right, Jing. How did you actually get recruited into doing the PHRC? How did you find out about it? What sort of motivated you to sign up to start with?
So it might work differently in different schools, but at King's College London, it was quite an informal process. So Dr. Flora, who leads the section, she posted a message on the forum. I think she posted it to fourth year and third year. No, yeah, she posted it to fourth year dental students saying, we're looking for 2 to 3 people in this year to, lead this initiative. You can learn a lot about sustainability and you might get the chance to make a poster and present it in a conference. So I asked around, I asked my friends who was interested, and I found 2 people who were interested. So we just thought, let's go for it. But it might work differently for different schools.
Yeah, well, good for you. And did you work then? So you said you worked with 2 friends. Did you also work with Dipani and her colleague who'd done it the year before, or did the 3 of you just sort of take it on yourselves?
So there were a few meetings with Dipani and her colleague, but we tried not to bother them as much because they were in final year and we knew it was quite stressful for them. But they were really helpful in sending their report over so we could skim it and see how they answered the questions and extract information from there. And it just made our lives so much easier having that sort of baseline information.
Yeah, okay, that's brilliant. And have you managed to recruit another team for this coming year? Because
Yes,
your
we
final year,
have.
presumably.
Yes, yeah. I found 3 really keen students who are now working with Dr. Flora to take on our roles.
Right, okay. So I don't see any hands up and I don't see any questions in the chat. So if you need to jump off, Jing, you'll feel free to go. Thank you so much for sharing your experience with us and good luck in your final year.
Thank you so much for having me. Have a nice evening.
No worries. See you later.
Bye.
Thank you. Okay, next up we have Ramisha.
Just share my screen. Can you all see that?
Yes. Perfect. Lovely. Thanks,
Yes.
Ramisha.
Yeah, I'm Ramisha, everyone, and I'm a trainee pharmacist, and I completed the Planetary Health Report Card in my final year, so that was last year. And I'm currently training in hospital and GP at the moment. So the reason why I joined the Planetary Health Report Card project was because I was really intrigued to find out a bit more about how health and the environment can link. I also wanted to explore kind of how in pharmacy education we can be prepared to be sustainable practitioners as a sort of my cohort and the newer pharmacists will be independent prescribers. So it's just having that conscious thought of how we can be more sustainable in our practice. I also wanted to contribute to something that would lead to sort of meaningful change at my university, and something that we could contribute to sort of and have that lasting impact. And finally, I was kind of inspired by the NHS net carbon zero policy and the sustainability sort of healthcare goals that we have. And as it's becoming more prevalent and more people are speaking about it, I wanted to kind of learn more about that. So this is a diagram that I used when I was doing my sort of dissertation, and it just is like a nice sort of visual representation of kind of how it all correlates. So when you have like sort of increased carbon dioxide in the atmosphere, you get rising temperatures and then more severe weather events, and kind of that all continues to go. But alongside that, you get the air pollution. And when you consider sort of patients, and particularly patients with asthma or cardiovascular disease, that can have a long-term impact on those populations. And then you have things like changes in vector ecology, and you have sort of changing migration patterns of vectors, which is bringing up sort of these infectious diseases in places that weren't there before. And it's how, you know, globally are we going to deal with that and respond to those sorts of things. And another thing would be probably like extreme heat. I know we've recently seen last couple of years heat waves, and that can affect kind of patients who are more prone to having heat strokes. So it's what we can do as sort of healthcare professionals to support our patients better. This is just to show what we've done at the university. So I was in a team of 8 students, and we were all final year pharmacy students. And I think Jing kind of mentioned the different sort of sections of the report card, so I won't go into too much detail about that, but essentially we looked at our pharmacy sort of department and our curriculum, and we retrospectively looked at the curriculum materials for the year before to check what was being covered in lectures, in workshops, and sort of the labs that we did when it comes to sustainability, and that's according to the Planetary Health Report Card metrics. We also sort of collaborated with staff and students and sort of staff that were kind of involved with sustainability initiatives. And we also got to look holistically at our campus and looking at also the research groups that we have at our university, and to see what they're kind of doing to support sustainability initiatives. And finally, we've got a chance to also analyse the results and suggest some sort of recommendations that the university can do to help our curriculum be more sustainable. So this is just to show kind of how we did at our university. So the blue is kind of how many points were available, and the red is what we scored. So as you can see, campus sustainability was our best section, and we had a lot of initiatives at the university where they considered sort of sustainability initiatives, whether it was like recycling bins or sort of the bus timetables that they had, and they like always had sort of leaflets, and they had things that were promoting sustainability at each of our buildings, whereas you can see sort of interdisciplinary research, community outreach and advocacy, and then support for student-led initiatives. We didn't do as well on those sections. And then our curriculum, we did okay, but there's quite a few areas we can improve on. So it was a good report to look at our university holistically and to see sort of the different sections and what we can do to improve those. So this is just a brief sort of summary of what we found. We found that in our curriculum, there was some mention of environmental impact, but we could have a lot more sort of education for sustainable healthcare incorporated in more of our lectures, particularly when it comes to talking about sort of medication related workshops, or a lot of times, for example, when we're learning about asthma, we could also talk about inhalers and using sort of DPI inhalers, which are more environmentally friendly. We also looked at our research at the university, that although there are some projects going on, there's not a lot for students to get involved, because that's something that we suggested. And then in terms of our campus sustainability, which was the best section overall, they had a carbon neutral sort of target by 2030, and they kind of set out good guidelines on what they're planning to do to achieve that. In terms of community outreach, we recognised that was a limited sort of public engagement from our university to support sort of the general public to be more aware of planetary health. And finally, for student initiatives, it didn't score as well, but there are currently growing collaborations with the student union to do more sort of events throughout the year for students to think about sustainability initiatives. So from this experience, I gained a deeper understanding of planetary health, and particularly statistics that talk about, like 250,000 deaths predicted by 2030 due to climate change. I also got to be a bit more familiar with the NHS net carbon zero target, and I could see from that medicines contributed to quite a large amount towards the current sort of carbon footprint of the NHS. So that's something that, as a future pharmacist, something to be mindful of and see sort of in my area of practice how I can be more conscious of those sort of decisions. And I also, like some of the others, got to present my poster at the NHS Share Conference, which was quite nice. So my top tips for students that want to get involved would be to start early. Although there was 8 of us, we did struggle to fit, despite having a lot of time, we did struggle to get everything done because the data collection did take us quite a long time. We had to look at a lot of materials. We had to reach out to a lot of different members of staff. So it can take a lot of time. So if you start earlier, you can set some deadlines and hopefully that will help you meet the sort of March target. And then also try to identify any sort of supportive staff early on. So any lecturers or any sort of sustainability officers, or even if you're reaching out to a different department, just to see if anyone's who's aware of what's going on at the university. And finally, something would be to delegate tasks. Just makes it easier, dedicate different sections. I mean, the first section's quite big, so having a couple people maybe to do that one would be really helpful. So yeah, thank you for listening, and I'm happy to answer any questions.
Great, thank you so much, Ramisha. It's great to hear everybody's sort of slightly different perspectives on this work that they're doing. So we'll come back to questions at the end. And last but not least, we have Ellie.
Yeah, hang on 2 seconds. Let me just get these slides to function. Hi, so I'm Ellie, and I did the Planetary Health. I was the lead for the Planetary Health Report Card at Keele University. I did it for 2 years, so in my 3rd year and in my 4th year. So what is the PHRC? I know that it's been said a lot, but just in case you missed it, it is student-led, which means that you do a lot of it, like you're in charge of how you do the research, how you look at stuff, and when you get things in. It's a school-based metric tool for evaluating the planetary health content of healthcare courses and what the wider university is doing across 5 categories, which are the planetary health curriculum, interdisciplinary research, institutional support, community outreach and advocacy. So in my 4th year and going forwards, the interdisciplinary research, institutional support, community outreach and advocacy and campus sustainability are shared with medicine and like other healthcare related courses such as physiotherapy and obviously dentistry, which we've heard from. So one of the things that we had issues with but got through was how do we communicate that not just within our own pharmacy school, but also how do we work with the med students and the physiotherapists and finding time for those as well. So onto our experience, the recruitment at Keele, we found a staff member, Sue, who was willing to send out a Microsoft form for students to sign up to with brief information on what the Planetary Health Report Card is. And then from there, we decided on a team of about 8 to 7 students, just to make it even. We had it across all 4 year groups. So we used polls to know when everybody was available at the start of the year so that we were able to discuss expectations. So how are we going to complete it? Who's doing what timelines were kind of expected from So like, when do we start working? How many hours should you work on it? We found that once you've got the information, it gets a lot faster because you're basically just checking the hyperlinks to make sure that it's all up to date and that the things that were there last year were still there. And then you're looking to see, okay, where were the gaps from last year and have we managed to fill them? And obviously we contacted an academic who was willing to help us complete the PHRC, which was Dr. Su Shen Wong, who's also on this call. So for us, we found that the workload was typically around 14 hours, but that's spread across the entire group. So please don't worry and think, oh my God, I'm going to have to spend 14 hours doing this. It's not that, it's spread across everybody. And of course, the workload does shrink depending on the size of the group. And some of that time was spent writing emails to academics to see, okay, I can't find this information, but maybe they have more information, especially on the interdisciplinary research, and trying to find out, okay, are we part of any groups, or is there any research going on that we're not currently aware of? For time management, that was a little bit of a struggle just because the first draft is due in January, which is exam season for a lot of people, at least at Keele. So we set internal ones earlier than the actual ones, just so that we had a bit of a buffer of in case people weren't able to complete the work, or there were things that we couldn't find, or we were waiting on academics to respond to our emails. And obviously, with being across such a big group of people and working with the med students and everybody, it's really important that we link in with each other and we make sure that everybody's on track, because you need to make sure that for those 4 sections, you have the same information and you have the same scores. Otherwise, when you get your draft back, it'll tell you with a big list of things where you're not quite the same. So if you minimize that at the start, then you don't have to try and cram it in as you're editing your draft. So I found that the benefits of doing the Planetary Health Report Card were, it's an opportunity to enhance your CV. It gives you tangible impact on your school curriculum and university through advocacy. So one of the things that changed from my 3rd year to my 4th year was that we had a student who does all of the planetary health and sustainability stuff go into student voice representative meetings where we share feedback to the school on what's going well and what's not. And then through this, we're able to implement things that the students want, and sustainability was then put in as part of that. It gets you ready for the Greener NHS and the GPHC Net Zero Action Plan, which is coming in. The GPHC one is for pharmacists. And obviously, like this, we were able to attend conferences, present as part of a panel, and as other people on this all have been through, we also put up a poster on the Share University Sustainable Health and Research Enterprise Conference. And these are the top tips and key learning points that we found. Look at it in the context of the university as a whole, not just as what your school's doing. You need to define sustainability, environmental, social, financial. Communication, you need to talk to the head of school, dean of faculty, academic, on awareness of the activity, but also to let them know that you are going to publish this, just to make sure that they're aware of it in case they're not. Because we were across such a big group of people, we used Teams to make sure that we could message each other. And we also used polls because people seemed to want to respond more to the polls, and it made it easier to see when everybody is free and what sections they want to work on. So that made it a lot easier for us to delegate the work out and be okay, you're doing this, you're doing that, you're doing whatever. And it also stopped arguments because people weren't saying, well, I thought I was doing this or any of that. And we had participation incentives, which were both school-based and through the student union, where we're able to log volunteering hours, and then if you get a certain amount, you get a reward at the end of the year. Any questions? Feel free to ask. Thank you for listening.
Great, thank you so much, Ellie. So I think a virtual round of applause for all our speakers this evening. Thank you so much, you've all done so well. So if people would like to either raise their hand or pop their questions into the chat, I'm just going to start off. There's one in the chat already from Ezekiel from the University of Liberia. You're very welcome. So Ezekiel's question goes to the third and final presenters. So that's Ramisha and Ellie. And the question is, after designing the curriculum the first time, did you develop the lessons to be taught at your university, or was your focus only on the PHRC? So Ellie, are you able to answer that first? And then I'll go to Ramisha.
Yeah, so obviously with us, it's not necessarily that we're a massive part of the curriculum and changing it. However, what we did use was we used the PHRC to say, okay, what is going on in our curriculum, what's not going on in our curriculum. And then obviously from this, we then implemented the sustainability student representative for our course. With those people, we're able to say, okay, this is what's missing from our course, and this is what we're here. What are we doing at the moment, and how can we improve that? And what's logistical for the lecturers, because obviously they're busy and they have a workload as well, but how can we integrate more sustainability into this specific type of content? So we use the PHRC to do that.
Okay, so it kind of really gave you a vehicle to kind of be able to sort of feed into that process. And did you find that the staff were receptive to that? Do you think the curriculum is kind of changing as a result of the PHRC?
I do think so, yes. And that was shown from our third year to our fourth year report card, and we were able to see an improvement within our curriculum. I'm not sure what it is at the top of my head, but I know that there was an improvement in the scores for the curriculum because of what we implemented.
Brilliant. Okay, that's fantastic. Well done. Ramisha, can I put the same question to you?
Yeah, I'd say it's similar to Ellie. Essentially, it was like a way for them to see a breakdown of what they're doing quite well at, and sort of where they can improve and what's actually being missed out on. There's like we have a lot of case-based sort of workshops, and they have a sort of prescriber-focused workshops, and those ones particularly, there was an area that they could actually just introduce those conversations and just start off by just asking, how would you sort of think sustainably when you're in practice, and just put that question out to the students. And then I think from then it makes that change just by being conscious of those thoughts around sustainability. So we just suggested just to introduce the conversations initially, and then going forward we can look into more specific teaching on certain topics.
Yeah, I think just getting the conversation started just raises awareness, doesn't it, and starts to get people thinking about it.
Yeah,
which is really good. Dipani, can I put the same question to you in terms of sort of changes to the curriculum in dentistry, because that might be slightly different to pharmacy?
Yeah, so we found that quite a lot of sustainable practices were already being implemented in our curriculum, mainly through the module led by Dr. Zara. So it was mainly just relaying back to her what we thought could have been discussed further or sort of implemented further. And she was very on board, and I think a lot of what we had sort of discussed had started to be implemented in the curriculum in her module, at least, to make sure it was being covered in one aspect or another. The campus itself had already set goals similar to the other unis as well, so they had already been sort of actioning things on their side, but definitely within our faculty of dentistry, I would say that the sort of department was very on board to implement these changes and sort of action them. The main sort of gap that we did recognize, however, with regards to implementing them, is mainly sort of in our clinical spaces, just because it's based in an NHS trust. So you'd have to sort of consult with them and their sort of infection control policies and things like that prior to sort of actioning sort of requests for sustainable practice. So
Right.
that was sort of the main gap we identified with Dr. Zara, that we'd have sort of little control over, but things regarding the actual sort of faculty, we had a lot more sort of leeway to implement change in.
Yeah, okay, that's great. So it sounds like you've all had an impact in terms of making an impact in terms of changing your curriculum. I was interested in sort of how this work impacted your fellow students and sort of whether you did any sort of awareness raising or whether that was just word of mouth in terms of sort of raising awareness amongst your fellow students. So I'm going to ask all three of you. So Dipani, what were your thoughts on that?
Yes, so as a part of the module, Josh and I, so my colleague that I completed the report with, did do a talk, a session with our fellow colleagues to sort of discuss our report card, our findings, and sort of highlight the issues that we'd raised in the report, and sort of emphasize to students to sort of be aware of their sort of actions and how it can sort of impact climate change, planetary health. So Dr. Zara did give us that space within our own module to deliver that as part of one of her seminars. So we were given that great opportunity as well to do that. So it was very helpful.
So you were able to do it in a kind of formal teaching sort of session.
Yes.
Oh, fantastic. Yeah. That's amazing. Ramisha, can I come to you? What do you think in terms of sort of impacting your fellow students?
Yeah, I mean, I recognise that when I spoke about the Planetary Health Report Card, a lot of people were surprised or didn't know really that sort of impact or the extent of that impact. So even just like speaking amongst my colleagues, you know, they were just learning so much from that conversation. We didn't have a formal sort of teaching session, but I know that my lecturers had uploaded and sent an email to our student cohorts just to have a look at the final report card so they can get an idea, and she did mention that she'll initiate like a group chat for students to kind of ask questions, and especially those who want to find out more, maybe do it in the following years.
Yeah, because it's recruiting students that is quite tricky as well, isn't it? So if you can drum up some interest, I think that's really helpful as well for future years.
Yeah.
Ellie, what about you and kind of influencing your peers?
So at Keele, we were really lucky because Sue was able to put out like the Microsoft forms to get students engaged with it onto the platform that we use across all 4-year groups, so that they have that information at the start of the year. Mm-hmm. And then as the year went on, we did carbon literacy teaching, and we put out forms for that, and we got people interested and involved. So we trained a lot of students to be carbon literate through that process and having that awareness. But there was nothing like specific where we stood there and we spoke about the report card itself per se, but we have the other kind of teachings of carbon literacy and how does that interact and the implementation of that and how can you implement it in your work life.
Yeah. And do you think the kind of interest is increasing just generally in the topic amongst students? Is awareness sort of going up, would you say?
I do believe so, yes. I think as we look at what's going on across the world at the moment with all the typhoons and things like that are happening, I think awareness is going up. And then we have all the flooding in the UK. So I think it is something that people are becoming more aware of, and actually, this is impacting us now. It's not just, it could impact, it is impacting. And I think that's raising a lot of awareness as it goes on and interest. And I think that's having an effect on how many people are turning up and showing up at these things.
Yeah, absolutely. Okay, some questions in the chat box. You're getting lots of praise, guys, for your great presentations. So, question from Stephen Doughty. Does anyone have experience or advice of where a single school, in his case a medicine school, delivers both medicine and pharmacy, and therefore how to implement the PHRC in a unified school faculty? So for each of you involved this evening, is your School of Pharmacy just a School of Pharmacy, or is it joined with allied health or nursing or medicine, or how does it work? For you, Ellie?
Right, so for us, we are just the School of Pharmacy. However, in the 4th year, we did work with the med students and physiotherapists. And we found that sometimes that was a bit difficult because obviously they have, like, we're on placement, they're on placement, everybody's on placement all at once sometimes, and then we're across all 4 year groups and everything as well. So it was difficult finding the time to work together. And then obviously we have I'm just going to get up. So, and then of course you've got the interdisciplinary research, institutional support, community outreach and advocacy, and campus sustainability, which if you're doing it across all of the schools that are involved, they have to be the same. So they need to be the same scores overall, even if you do something slightly different. But the only thing that's different is the curriculum. So what we found quite helpful for us was we sat everybody down in the same room when we could, and we just focused on getting through one section at a time. However, when that wasn't possible, what we did was me and the other school leads went through our report cards together, and then we made a document of, okay, this is different, this is different, this is different. Why are they different? Yeah. And then you take the highest score one, and then that's one that you put in your report because it's being done within your wider university. Okay. But then we use that for advocacy to get funding for ourselves.
I see. Very good. Okay, if anybody else in the room has experience of the kind of the question that Stephen's posting about sort of a joined school and how you've done that, just put your hand up or speak up. It sounds like if you're doing it separately for different schools, a lot of the information that you need to submit is shared anyway. So possibly the best approach would be to get some students from medicine and some students from pharmacy, and then you can submit it to both. You can submit a report for both of the different schools with much the same information. I guess it's going to be mainly the curriculum information that's going to differ. Anybody else in the room sort of want to say anything different to that?
No, I was just going to say exactly as you said. So except from the curriculum section, all other sections can be done together. So that's the only section that's different. So if you can collaborate, that's quite good because there is a lot of different aspects to those sections. So it's the more you have, the better, I guess.
Yeah. The other question actually, which links to this, is what support or kind of information, if any, did you get from the PHRC as an organisation? Because that would be the other thing to do, is to go back to the PHRC and ask for guidance in terms of, we're a joined school, how do we do this? Did any of you have a lot to do with the PHRC as an organisation?
We had to reach out to them just to clarify a couple of questions, and in our sort of curriculum section, we at our university don't have like elective placements like the medical students do. So it's just how do we go about scoring our university when we don't have those facilities. So we did have to reach out to them a couple of times, and they were really supportive actually. So it was quite good to have that guidance and regular communication with them.
Great. Okay, thank you, Ramisha. And Sue, you've got your hand up. Do you want to go ahead?
Yeah, I just wanted to address Stephen Doughty's question. And
thank you.
Noella, there's a interesting thing that's happening over here. So at least my students, we have noted, but I'm actually Stephen Doughty's ex-student. There you are, 3 generations.
Oh, no way. Pharmacy is such a small world, guys.
Yeah. So the way how we've done it, so since Ellie's graduated, we are officially now a combined school with physiotherapy. So we are now the School of Allied Health Professions and Pharmacy, but we are distinct program-wise. So as highlighted by all the presenters, is the curriculum section that needs to be distinct. So that can be done separately. But sections 2 to 5 onwards obviously is graded as an institution. So it will be handy if you've got, or at least you can put your students in touch with either faculty lead, or for us, we are lucky enough where we've got somebody who sits in the Vice Chancellor's office as a head of net zero and sustainability. So we do have a very coherent strategy and how we actually tackle this, so it should be quite straightforward that way as well.
Okay, that's great. Thank you so much, Sue, and love that we're making connections within this webinar. Fantastic. Okay, I'm conscious of time. Does anybody have any further questions? I'm just going to share our final slides. Oh, Cozy is saying, how did you identify and contact the lecturer staff that would be most useful collaborative for the project? Anyone want to answer that?
I can take that one.
So, you go.
Oh,
Go
thank you. Josh and I mainly used sort of the authors in the publications involved and sort of reached out to them if any gaps were in the publication. Dr. Zara was sort of the lead for the module as well, so she was sort of our main point of contact, and then she would sort of direct us to the appropriate individual as well, or get us in touch with them as well. So we found that we were able to get quick responses, and Dr. Zara sort of reached out to us, so she was very on board anyways. So she was a very good staff facilitator as well.
Brilliant. So you had the interested member of staff who kind of raised awareness about it, and they were the person. Ellie, what was your experience? You were going to speak as well.
So I'm really fortunate that we had Sue, because she's really engaged, and at the start she engaged with us. However, if you don't have someone like that already, what you can do is you can reach out to a lecturer who you know either A, has an interest in it, or they're really engaged with their students, and see what availability they have around time and let them know of the time frame, and then see if they'd be willing to help you and like mentor you through this year, and seeing if they'd be able to do that. And then we just found out where the gaps were, and at Keele we're fortunate to have lecturers that want to interact with us and go about and answer our questions that we had. So I would say the main thing is to reach out, see who's willing to help you, look at what the content is, and also if you're looking at the interdisciplinary research, what you can do is you can look at your lecturers' like past publications and see if they have anything to do with sustainability, and from there email them and see if they have any interest in helping you.
Yeah, okay, great. Thank you for that. And I know there's some University of Sheffield students here this evening, so contact me. I'm going to be the person. Okay, any more questions? I hope you're reading the chat, Ellie and Ramisha and Dipani. There's lots of praise and thanks for your sort of insight and all the sort of helpful tips that you've shared. I think people are going to find that really, really helpful. So again, thank you so much for coming along and giving up your time tonight. You're busy professionals now and busy final year students. So we really very much appreciate it. Just going to show a last couple of slides just to sort of remind everybody to please join our CSH networks. As I said earlier, they're free to join. Once you get registered, you then log in and sign up to as many networks as you would like. Do please spread the word. If you're educators or students, let your colleagues and your peers know about CSH and the work that we're doing here.